Hello, everyone. Welcome back to Health Check. You know, we always say life gets better when you check. So, today, a very interesting episode. I'm talking about falls. I'm sure you've seen in the caption. Falls is something I take personal. I'm quite passionate about falls, and usually among the elderly. So, on today's episode, I have with me a guest, and she's going to introduce herself, and then we dive right into today's topic. So,
My name is Akia Anan. I'm a physiotherapist by
okay.
background, and at the moment, I'm program director for Medics Health College.
Nice. Okay. Seems you sound like you have experience in falls, right?
I've got about 15 years of experience in
Okay.
falls from the
Okay.
UK.
Right. So today we are, as much as possible in the short time we have, we're gonna squeeze out the juice concerning falls. Okay. We know falls is like I said earlier on, usually we are worried when an elderly person falls. Okay. So what can you tell us as intro concerning falls?
Right, basically, everybody falls.
Okay,
You fall
yes.
right from the start when you're born, you fall and you get up. But the problem becomes a problem
Yeah.
when you're older. Because when you're older and you fall, the consequences and the further developments of other conditions is much, much more
That's true. Okay.
evident. Yeah.
Okay. And elderly falls because usually when a younger person falls, you're able to get up and
Yeah.
then brush yourself up and then move on with life. But when it comes to an elderly, I've seen time and time again a number of patients come with the complications of falls. And the issue with falls is that they are preventable, but the dire consequences of them are sometimes even deadly. Okay, so we are taking time to discuss falls, the risk factors concerning falls. We have an expert opinion on preventing falls and how to deal with falls generally. So I want to go to the risk factors. What can cause someone to fall? Okay, what are some of
So
the risk factors?
basically, there's been evidence, a whole number of things that can cause falls.
Okay.
We've got modifiable and unmodifiable
All
sources.
right.
You've got intrinsic and extrinsic, meaning
Okay.
something that comes from internally
Okay.
and something that happens from outside.
Okay.
So if we're talking about intrinsic, let's say intrinsic will be like the high blood pressure, hypertension, diabetes, knee problems, arthritis, all those kind of things from within, malnutrition, a whole lot of things, your muscles, your joints. But when you talk about extrinsic factors,
Okay.
you're looking at the environment. So
Okay.
you're looking at your flooring, your lighting, you're looking at wet surfaces,
Okay.
and all the other outside factors
Okay.
that can affect falls.
Okay, so I'm going to read some stats or some facts I found online and then we'll discuss them. Okay. So the risk of falling is increased in older adults because these functions decline with age. So they mean the nervous system coordinating a normal gait, it declines with age. Next, the probability of accumulating medical issues increases with age. And then associated medications are often increased as well with aging.
Yeah.
So what can you say about these risk factors that come with aging and the increased risk of falling?
Right.
Yeah.
So the medication, I'll start with medication.
Okay.
A lot of people take a lot of medication because of probably hypertension, all the other medical problems that they might be facing with age.
Okay.
So it's advised that if you take 4 or more medication, you should have a review at least every 6 months.
That's
To
true.
make
That's
sure
true.
that,
Polypharmacy.
yeah, to make sure you're taking the right thing, as well as it's not complicating factors for you. So it's important. When it comes to the other risk factors, like the medical aspect of things, with
Yeah.
a different, let's say, for example, somebody has diabetes,
Okay.
and if they are not checking it properly and not taking the medications properly, they become hypo, they faint, they'll fall.
Yes.
So those are the kind of things that will create falls as well. Similar to hypertension. If your blood pressure is so high, it can cause you to fall as well. So falls comes most of the time with something.
Okay.
And when that is not checked properly, then you are at risk of having these falls.
Okay. So another risk factor I'm seeing is vision problems.
Absolutely.
So we have glaucoma,
Yes.
cataract, reduced visual acuity, and all that. And all these conditions actually increase with age. The
Age.
risk of getting them increases with age.
Absolutely.
So we have foot issues, foot pain,
Yes.
issues with footwear.
Yeah,
Do you want to say anything
footwear.
about it?
With
Yeah.
footwear, a lot of people, I'll say the ladies, like
Okay.
high heels. You've worn high heels your whole time, or you want shoes with heels. But as you age, with muscle decrease and a lot of the joint problems, wearing those heels are not advisable. But
Okay.
some people still want to push and wear their heels, so you have to be
Yeah.
careful. You choose between fashion and health.
Okay. Right. Right.
Yeah, and for the men as well, they wear shoes that probably is too tight or is too open, is too loose. The main factors for a shoe to be worn, especially at old age, is to make sure that the toes are covered, is not squashed, and as you've got a strap in the back or a support in the back,
Okay.
and the sole is not too hard, so
Right.
that it's not pinching you as well,
Okay.
because all of those factors can affect you. And a lot of people have developed bunions and changes in their foot
Okay.
structure, and
Okay.
that also can cause you to
That's
fall because
true.
it's causing you pain.
That's true.
Yeah.
People have foot deformities, like
Yes.
diabetes can cause this foot deformity. And
Yeah.
with that, you're not able to walk properly. Your
Properly.
gait changes.
Yeah.
You can
Yeah.
easily trip and
Yeah.
fall, right?
Yeah. Yeah.
So I have this interesting risk factor, solitary lifestyle. It says living alone appears to be a risk factor for falls.
So basically, living alone, you
Yeah.
do everything by yourself, and a lot of people would sit more than move about when they're living alone. They've got nothing to walk around for, so they'll sit a lot. So that in itself puts you at risk, because sitting is not what we're made to do. We're made to move. No matter what you can do to move, you have to try. When people retire, they end up sitting alone
Yes.
indoors doing nothing.
Yeah.
So all of that becomes a vicious cycle, and it puts you at risk of falling. Living alone as well, like a lot of people have, there's a lot of statistics to say people have falls in the bath, and that is quite
Yeah, that's true.
significant,
That's true.
because it's slippery. You go in and you just trip and you fall. They've got mats around as well. Living alone, you trip over your mat and you're on the floor. So these are all things that, if you live alone, you need to at least have somebody that checks on you all the time, or
Right.
call somebody all the time, like have a specific time, specific arrangement with somebody close by, or even if it's a phone call away, or have a mobile phone on you all the time. So
Right.
as soon as something happens, you're able to call somebody, at least press a number to get somebody to help you.
Very true. Because I've realized by taking care of some of my patients, right, you can see this fall is as a result of neglect. You know, these elderly people, we leave them at home
Yes.
and they are all alone. They have to do things on their own.
Yep.
And that's where the problem is, neglect. So we shouldn't leave them alone. All right. So I
I'll
see.
say, sorry,
Yeah.
I'll just add that check on people.
Right.
Even if it's not a relative and you know it's an older person close by, lives next door, check on them. Just keep an eye on them in case one day, they come out every day to hang something, or and they've not done it. Check on them.
Okay. Check on people, right? So I see a history of a fall as a risk factor for another fall.
Yes.
Okay. Seeing that when people fall, they're afraid of falling again. So they limit their movement. Meanwhile, you're encouraging us to walk.
Yes.
Okay. But because you're afraid of falling
They don't move.
again, yeah. What can
yeah.
you say about that?
It's a fear. It's a fear, and fear is a big thing. Fear is an emotional, mental issue that a lot of people have to deal with. A fear of falling is a real thing. People will move because they feel they're gonna fall as soon as they move. People won't use their walking aids, even if they said they look old, so they wouldn't use a walking stick or something. But all of these things support you.
Right.
And when somebody is fearful of falling, they need to practice and learn and understand. Tell their mind that they can do it, and then get on with moving. Because definitely, if you don't move, you sit, you're gonna fall, because your muscles, your joints all freeze up, they become stiff.
Right.
And then that's what causes you to fall. So there's one test that helps a lot.
Okay.
Everybody, even in a young stage, you stand without holding a chair.
Okay.
If you're standing up and you don't hold on the arms of a chair, that means your legs are strong enough. And there is evidence to say that if you can do that,
Okay.
your risk of fall is quite low.
It's low. Okay.
Yes.
So you can try this experiment
Yep.
now, right? To
Yep.
test your lower body strength, to see if you can stand up without support, without holding
Yes.
anything, right?
Yes.
Okay, great. So now let's just go straight to how we can prevent falls, knowing that falls have lots of unwanted consequences, from traumatic brain injuries to fractures, which are deadly, hip fractures,
Yeah.
pelvic fractures, which are very, very problematic. Now, how can we prevent falls?
Right. So we've kind of mentioned some of them.
Yeah.
Main thing, move, exercise.
Right.
Exercise. Don't stay static for too long. Don't sit for more than an hour, especially older people. Don't sit for more than an hour without moving. Make sure you eat well. Nutrition is quite important. So you're supplying your body with the right nutrients. Drink enough fluid, because when you're dehydrated, that can cause you to fall. Make sure you're taking your medications right, checking your blood pressures and your blood sugars, and eating the right things also to prevent further complications. Make sure you're wearing the right footwear. Make sure you're lighting in your room. Some people wake up at night and just go through the dark into the toilet, but sometimes you're not sure, you're a bit groggy, you might trip on something and you fall. So make sure you've got good lighting. Make sure you have the floors are not slippery. Now,
Yeah.
Ghana, please, everybody has tiles. Oh my gosh, that is so scary.
Yeah.
Those tiles, a little drop of water or any kind of something, powder will
Yeah.
go on there. You
Yeah.
dress up with powder and you're on the floor.
Yeah.
So please, those towels, please, I know it's nice, but it's deadly. So we need to look at our surfaces, indoors, outdoors. You need to really think about it. If you've got slippery floors, please be careful. Rugs and mats and things like that, they're beautiful, but they are deadly.
Right.
So look out for them. If you've got pets, like you've got cats, dogs, watch out for them as well, because
Yeah,
you
they
can
could
trip
easily.
on them.
Right. Right.
And one thing that people would say, oh, why are you saying this? But if you've got grandchildren coming around, you
Yeah.
need to be careful around the old elderly people, because they could trip on them as well. So
Right.
it's something that you wouldn't think it can happen,
Yeah.
but it does.
Yeah.
And then, of course, if you've got stairs, make sure you've got the right rails around it to support
Right.
you. If you go in and you're using a bath, I would advise to use a wash area instead of a bath, because the
bathtub.
baths are slippery
Yeah.
and it can cause you to fall as well. And if you definitely have to use a bath, make sure you've got railings that you can hold on
Can
to
hold on
to
to.
support yourself.
Right.
Yeah.
Nice. Nice. Sounds really good. So, what do you say about living upstairs as you age? Because I feel you should stay on the ground floor as you age. You don't have to be climbing stairs and holding on to the rails and all that. So, what do you say about as an advice to living conditions in the house?
Yes.
You're already talking about it, but
Yeah.
staying downstairs, staying on the ground floor, just so you don't have to use the stairs.
Yeah. I agree. I agree with that, but you can't really always know your living, area. Maybe you live in an apartment and you have to go upstairs. So all you have to make sure you keep a rail by the side so it help you to climb the stairs. Climbing stairs is quite good actually. It keeps your lower limb strong. It keeps your heart beating. It's good. But if you're not able to, you've got the arthritis and it's difficult to climb stairs, then you need to reconsider and get yourself a downstairs living
Okay.
space. Yeah.
Okay. And there's this advice I saw to stand up slowly, because as you age, it's a condition called orthostatic hypotension.
Yeah.
If you stand up quickly, your BPs can drop
Yeah.
drastically, and that
Yeah.
can cause you to get lightheaded and fall down. Okay. So, what can you say about that?
Okay, so that's another very good point, because people rush, like you hear a bell or if somebody calls and your phone is far and you're rushing. Don't rush. If they
Right.
need to talk to you, they'll wait for you. If they need to see you at the gate, they will wait for you. Don't rush, please. You will fall, because like he said, the orthostatic hypertension is not a nice thing. You stand up and blood does not get to your brain fast enough,
Right.
so you would fall. So one key thing is, if you have that condition anyway, you need to drink water, sip a bit of water before you stand up, and make sure you're standing up slowly.
Slowly,
Because the
right.
water helps to drag up the blood to your brain. So that is something, like when you lie down, a lot of people just get up and then they're going. Try and sit at the edge of the bed before you move, or try and have a little glass of water there. Take a sip before you move as well.
So, I have this question, right? Someone says, I've had a fall, but I didn't feel any pain. So, I got up and I'm ready to go. Do I need to see the doctor even after feeling normal?
Yes, it's advisable too, because you don't know what caused you to fall, first of all.
Okay.
So you need to check and see what might have caused the fall. Secondly, sometimes you have some breaks that you don't really feel initially,
That's true.
but in the future
That's
it will come biting you. So it's just best to just get yourself cleared out.
Yeah.
Just get a medical professional to have a check over, and then you're okay and you're
Okay.
on your way.
Okay. So
Yes.
you're in Ghana, right?
Yes, I
So I want
am.
to ask you for an advice tailored to Ghana. What can you say about looking at our setting, looking at the old people around? First, there's this stigma or stereotype around using walking aids, using walking sticks, using a wheelchair, using a Zimmer frame, all sorts of things. Meanwhile, they are needed, but people run away from them. You're old, you need it, but you're saying. So, what can you say about it? I know
Okay.
generally, yeah,
Okay, so actually, this is not specific for just
for
Ghana.
Ghana, okay, okay,
Everywhere,
okay,
old people don't want to use walking aids because
okay,
they say it makes them look old.
okay.
You are old anyway. There's no two ways about it. Do you rather want to be found on the floor, or do you rather want to be safe holding your walking aid?
Yeah.
That's the question you need to ask yourself. Now, the walking aid, everybody uses a walking aid when needed. The walking aid is not a part of an old person, it is for support. It supports you to walk. If a young person has a fall or breaks a leg or something, they will use a walking aid, and there's no problem with that. So for the older person, it's just, I'll keep saying, it's your third leg, because your two legs are not as strong. The joints, you've worked hard, you've sat down, you've done so many things, and it's just grown tired. You just need support. So using the walking aid is a support just to get you going. So please don't refuse it. Try and
That's
use
true.
it. Sometimes you would use it for a few months and you wouldn't need it again.
Thanks. Do you have any like personal story without disclosing patient identity, but any personal story or encounter with such using walking aids? Looking at the way people really, really don't want to use walking aids, but they need it. So can you
Okay.
give an example of how it has improved someone's life?
Oh boy, loads. Okay, so basically, as a physiotherapist, you use a walking aid to for rehab. Is to build the person up. So you might start off with a walking frame because
Okay.
that has four legs. So you need that support to go. So I've had lots of clients who will say, "I'm not using that," and then after a few days, they can't get up, they can't move. So they'll come back to you and say, "That thing that you said I need to use, can I have it?" And you will prescribe it, and you will start with the frame, and after a while you will go to a walking stick, and then after a while you wouldn't need anything.
Okay.
And that happens to young people, old people. It's not about age at all.
Okay.
It's a support, as I said before. It's to support you to move, and you need to move, so you have
Right.
to use something to move.
Okay, nice. So, final advice concerning falls. You know, you've talked about falls and the fact that it's one of the most common causes of disabilities, especially in the elderly. And falls is trending in Ghana. Lots of people are falling. I'm sure while watching this video, someone might unfortunately fall down. So, what are you saying in summary? What are you telling us? You've really given light to the risk factors concerning falls, how falls occur, how to prevent falls both in the house, domestic falls, and then even outside. So, what can you say as a summary for
Okay.
that?
So falls are preventable. You can
Okay.
prevent falls. And this is like everything we've talked about. Make sure you are moving, you're exercising, you're eating right. Make sure you're checking on your medical problems. Don't leave things and say, oh, the next day or next time or whatever. Don't put things aside. And especially, I would say for men,
Okay.
men don't like checking anything
Right.
medical. So please, you need to, and you need to exercise. Exercise is not just, doing weights and all that. Walking, just go for a long walk. Make sure at least 30 minutes every day. It's
Okay.
great. Men, you can go play football with your friends. Women, go walking. But another big thing, dancing. Make sure you dance. Put on music at home and dance. It will help with your balance. It will help with your strength. It will
Right.
help with your whole well being, your emotional, physical, and everything will be great.
Okay. So, I know I said last words, right? But you're in Ghana, right? So, just in case, caretakers of elderly want to find out, what can they do in the Ghanaian setting to help curb the falls in elderly? What can they do practically here in Ghana? Are there any fall centers to visit? No, there aren't. If there's a fall, visit the hospital for a checkup
Yes.
and all that.
Yeah.
But prior to the fall, usually, you've given very, very good advice here. But so a good example is, how do I know my home is safe when it comes to falls? Yes, I have rails on my stairway. I don't have racks on the floor. I probably don't use towels or all that. But there's something like a home environment assessment. Okay, so what can you say about that?
Yeah.
And is this something you do?
Yes, that I do that. That's
Okay.
that's what I was going to recommend. I do home assessment to look at everything. I look from head to toe of the client. I'll look at their environment, their medical conditions, everything. I assess the whole lot, and then I'll
Okay.
give you recommendations on that and show
Okay.
you. There's some shops I know where you can get stuff as well,
Okay.
right here in Ghana.
Okay.
So I would advise that and
Okay.
recommend that as well.
Okay.
Yeah.
All right. All right. Thanks for your time. Thanks for this comprehensive explanation of falls in the elderly. We hope you don't fall, and then we'll see you on the next episode. All right.